Good evening, everyone. As we discussed yesterday, today was scheduled to discuss brachial plexus formation and the branches, their location, and their importance. Why is it important to know about the brachial plexus? Because brachial plexus, let me tell you, not just are important for MRCS Part A, they are also important, equally important for anatomy examination of MRCS B. So, what I would suggest you that you should practice and you should practice and learn to draw the brachial plexus because sometimes they can ask you to draw the I'm sure you can see draw the brachial plexus on the subject or the the patient. So if you can just begin by drawing 5 small circles like this, and if you can look at this diagram, there are a lot of questions come from the MCQs comes from brachial plexus. I have to see because I'm not sure if you can see the entire, if I'm sharing the entire optimize clip maybe. If I'm not sure if you can see the whole. I'm not sure if I can write or is it just the little bit you are seeing. Optimize for video, I don't know. Yeah, maybe now you can. I'm sure. All right. So the formation of brachial plexus normally they are formed from cervical C5 to T1, C5 cervical 5 to thoracic 1, but they can be prefixed or the postfixed brachial plexus as well. When they are prefixed, then they can even be C4, which is not normal or usual, or when it is postfixed, then it can even include T2. So basically, if you remember the brachial plexus, that would be good. Brachial plexus are mostly formed by roots and then roots and then trunks, divisions, and then cords. Right, these are the cords are the 5 branches that we see in our upper limb. Whereas if you'll discuss the roots, so all the roots, they are present or maybe roots are present. And then the divisions, this area here, divisions, they are located in axilla. And if you discuss about the cords, lateral, medial, and the posterior, so they are named as per their relation with the axillary artery. So altogether, this brachial plexus gives or causes the formation of 15 nerves. And out of those, 5 are the major that you all know. So they are the axillary nerve, branch of the posterior cord, and then the radial nerve, right? And this is radial, this is axillary, and then ulnar and median and musculocutaneous. So this is median, this is ulnar, and this is musculocutaneous, right? Coming back again to the roots. So the roots are formed by C5 to C6, anterior MI. They combined and then they form C5 and C6 anterior MI joined to form the trunks, whereas C7 remains single these trunks are divided, and the lower one is C8 and T1 unites to form inferior trunk. So they are superior, middle, and inferior. That's how they are formed. Then if you look at the anterior part of this superior trunk, unites to form the lateral cord. It's called lateral, as I told you, as per the relation with the axillary artery. Whereas anterior, one part of the anterior along with the posterior part of upper, middle, and the posterior forms the posterior cord, and whereas the anterior part of the lower trunk or the inferior trunk continues to form the medial cord. All the posterior from the upper, middle, and the inferior unites to form the posterior cord as relation with the post axillary artery. So these cords then gives branches which supplies the upper limb. And if you are asked how many branches there are in the roots, so you could see from the roots solely from C5, 6, and 7, long thoracic nerve is formed. Tell me, this long thoracic nerve supplies which muscle? I'm sure you know that, right? Then also from C5, there is dorsoscapular nerve arises. And there is another branch, nerve to subclavius, which also arises from the roots. So 3 branches from the roots. There are no branches from the trunk. Remember, there are no branches from the trunk. And then when it comes to division, suprascapular arises from the divisions. And these anterior of the upper and middle unites to form the cord. So these are the divisions, anterior, posterior, and right. Now coming to the cords. So from the lateral cord, as you could see, these are the lateral pectoral nerve, which arises from the lateral and the medial cords. Also, you can see, right, the lateral cord gives branches like musculocutaneous and median nerve, right? Whereas the medial cord gives branch to ulnar, medial cutaneous nerve of the forearm, and the medial cutaneous nerve of the arm. So this is the sensory supply of the arm and the forearm from the ulnar nerve or the medial cord, whereas the posterior cord gives branch to upper subscapular, thoracodorsal, lower subscapular, radial, and axillary nerve. So these are the brachial plexus. What more I can tell you about the brachial plexus, that they are subject to injury during several procedures that you have to remember. First, there are certain conditions which result and they injure brachial plexus, either the upper root or the lower root. When they injure the upper root, it is called the Erb's palsy. The lower root is injured, it's called Kemp's injury. We'll discuss these injuries tomorrow more in detail. What I want to tell you today is to remember that during the dissection of mastectomy, axillary dissection of the mastectomy, intercostobrachial nerves are frequently injured. And these nerves traverse the axilla and they supply the cutaneous sensation of the medial aspect of the upper arm. Another thing, that the long thoracic nerve, this one, which supplies the serratus anterior muscle, these ones, they can also get injured during mastectomy or any breast cancer surgery, along with the lateral thoracic artery. Right, and also you can say the lateral thoracic artery could be the second branch of the axillary artery. It's actually the second part of the axillary artery, because both of them are supplied or accompanying the serratus anterior muscle. So long thoracic nerve, along with the second branch of the axillary artery, which is called the lateral thoracic artery. We'll discuss this later in details. They are supplying the or accompanying the serratus anterior muscle, the anterior muscle of the chest wall. And then they get injured, and that's where these nerves can also get injured. Another chance is that because of the axillary surgery, trochodorsal nerve, you can see the trochodorsal nerve is here. Here, branch of posterior cord, trochodorsal nerve. So this trochodorsal nerve, middle subscapular nerve, or the nerve to the latissimus dorsi, these are all the names of the same nerve. They can also be injured after patient, like after breast cancer surgery, when patient is unable to touch the scapula with hand. So it's the trochodorsal nerve injury which occurs most commonly. All right. So what we'll be doing tomorrow, we'll be discussing or we'll be looking at the lesions or the injuries of the brachial plexus. So revise those because you should know how important these are. Many MCQs, SPA, single best answers can be written by this information. And also, if you learn this, it will even come handy for your Part B exam. So that's something which we have to focus more on. Right, with this, I'll end today's revision. Thank you. Bye. Good night.